joined us. You're watching Newslink on DSTV channel 403. Now, domestic workers cannot be dismissed because they have HIV. One such worker was dismissed in Cape Town last month shortly after disclosing his status to her employer. She approached the CCMA about her unfair dismissal and will now be returning to work. Let's discuss the challenges still facing workers in this sector with Treatment Action Campaign's chairperson, that's Sibongile Tshabalala. Ms. Tshabalala, good morning and thank you very much for your time. You know, when I first saw the story, if nothing else, I realized that there's still a lot of educating that needs to happen around HIV, its treatment, or even transmission thereof. What did you make of the story when you first saw it?
It is saddening us to learn that there are still employers who are doing this to their employees, I mean to say. And I think we have made enough, and we thought that we have encouraged everyone to know about HIV, to dismiss all the myths that were there, to say if somebody who's HIV positive is living with you or using your cups and everything, using your toilet, that person can transmit. But it shows the level of ignorance that people still have, that in 2022, 40 years of having HIV, there are still people who are treating people living with HIV without respect. When you disclose your status, then you are fired from your work. But also we need to look at the deep issues of how this has happened. Remember that this woman is a domestic worker, and at some point, it's the stigma that she faced. She faced the stigma at work, also in the facility, where the system is also still discriminating in terms of people living with HIV. I don't think that woman disclosed her status to the employer because she wanted to. It's because she wanted her life to be easy, so that when she has to go and collect her medication, yes, the employer knows when is she going. But then if she didn't disclose, she can't miss work because on that day she won't be paid. And when she goes to the facility, she will spend the whole day in the facility. If she misses her date on the facility, she will be punished again. So you can tell that our system, our people on the ground are still not yet well educated, especially those who are working like domestic workers, are still oppressed, are still their rights are still violated. And I was so saddened because this happens in the month where we were supposed to celebrate Women's Month. But what we see, it's very disgusting and it's very unpleasant. We are not happy as women of this country, as Treatment Action Campaign.
No, it's very disturbing, but we are pleased to note that, in fact, even before the ruling, the employer had already asked the domestic worker to return to work because he had greater appreciation or understanding now of how HIV is transmitted. But if we had to go back, or at least if I were to note what you stated, you kept on saying this can be characterized as perhaps ignorance, not discrimination in the part of this family, because it seems they honestly thought having her around now that she has disclosed would mean they were going to get HIV. So clearly, like I said earlier, there needs to be a lot of education. It's not so much discrimination in certain instances like these.
Yes, it's true. It shows that we still have to educate people, and you know those especially the madams or the people who are hiring domestic workers are the ones that are left out in most of the cases because they are working also somewhere. And when we are doing educations, we mostly focus on the public healthcare sector. We forgot about the private healthcare sector, of which these people are using private healthcare sector. That's where the information is not there. So it means then we need to strengthen the level of education, but also our system has to respond to such issues, because we can talk about women now. How many men who are gardeners who have lost their job because they have disclosed their status? And also the question that we need to ask ourselves is that why this employer tried to learn after she fired her, after they fired her, why they didn't learn before that to say, okay, Sibongile disclosed to say I'm HIV positive. Sibongile educates us. What is it? What is HIV? Why are you HIV positive? How do we live with you? So and they do their own research, because at this time and age, I don't think that there are people who cannot do their research. They were supposed to do their research. You can't just fire a person just because she disclosed her status. So it shows that oppression is still there, and the level of ignorance, I'm going to continue to say it, in terms of people who are hiring people like your domestic worker industry, which it's mostly have violations of women and people and men who are gardeners there, because they're not treated well, but because of poverty and other issues that are affecting them, they are unable to raise their issues even if they try. So that tells us that we need to go to those communities of people who are employing, especially in domestic work industry. We know now there are agencies that hire domestic workers for people. We need to discuss with them. We need to sit with them. We need to give them that information, and they need to give these people who want to employ other people, so that they don't discriminate people and they don't fire people just because of HIV.
And I suppose such unfortunate incidents, though, lead or are a moment to learn for many others, because having seen this, it's been publicized so much, many will now learn as perhaps employers or future employers of domestic workers or anybody in any form of employment that might want to disclose. But if we had to talk about the disclosure, I mean, one assumes there's a level of vulnerability that comes with having to share about your life and your health status. Is it really all that important in the workplace? I mean, in this instance, she could have easily said, I'm fetching sugar diabetes medication, you know? But she went on to state that it is in fact HIV. Is there really that obligation to disclose your health status in most employers, or do they force you to do this at times? Have you seen such?
Actually, in cases like this, especially domestic workers, we have experienced that a lot, where employees were forced to disclose their statuses to their employers. But it's not an obligation. You don't have to, as much as you might tell your employer that I'm not feeling well, I often collect my medication, that it doesn't, there's no legal application that says you need to disclose that you are living with HIV or what kind of medication you are collecting. You can just say, I'm not feeling well. Everyone has a right to have a sick leave. So even the laws, everyone says, the labor law says everyone has a right to a sick leave. Everyone has a right to information not to be disclosed, especially the HIV information, because it's crucial. The level of where a person decides to disclose, as I'm saying, that maybe this woman was forced because of the circumstances to disclose her status. She was not ready, maybe, or she was ready, because some of us, we are ready to say, I'm living with HIV openly. There are people who want to live openly and live their life freely. So maybe she was trying to say, I'm living with HIV, I'm open about it, so you must know as my employer, so that you know how to talk to me, how to work with me, and you must know that you are not in danger. There's nothing that can harm you because I'm living with HIV. It's just that I have to be healthy, I have to take my treatment every month, I have to make sure that I continue to live longer. So there's no legal obligation to say I need to disclose my status. I disclose my status because I want to. And there's no one who has to force me to disclose the status, but we see that happening mostly on domestic workers.
Ms. Tshabalala, thank you very much for your time this morning. That's Sibongile Tshabalala, Treatment Action Campaign's chairperson.